Honorable Speaker, on behalf of members of Sector Committee of Health, it is my pleasure and duty and privilege to present a progressive report. Under health, I have a committee of 23 members and my able Vice Chair, Lily Kidenda. Health has 4 chief officers. We have health facilities headed by Ibrahim. We have medical services headed by Dr. Irene. We have public health headed by Tom Nyakaba. We have wellness, nutrition, and school feeding program headed by Amina Mohammed. Honorable Speaker, the committee have done 30 sittings, and on these sittings we were able to have 1, consideration of bills and regulations. Under the bills, we had Food Safety and Fortification Bill 2023, which was enacted into law. We had a draft school feeding program regulation. Under the Public Finance Management, the Nairobi City County School Feeding Program Fund regulation, which has been a cry in the committee because we have never finalized it due to some reasons which are from the executive. And we are still waiting for the CEC to organize for a meeting for the committee to go through final on the regulations that they have amended. And that is why we don't have policies and the regulations on the school feeding program. Considering, we have considered number 2, under these meetings, we did consider budgetary, the fiscal strategic paper 2025-2026, the ADP 2024-2025, the budget estimate supplementary financial year 2024-2025. The third meeting was consideration and deliberation of statements. The fourth meeting was inquiry and status operation of county hospitals, the level 5 hospitals. The committee held a meeting with county level 5 hospitals officers and planning for site visit inspections. Number 5, the 5th meeting was sensitization meeting with stakeholders, where the committee had a meeting with the Pharmacy and Poisons Board to consider allocation of budgets for disposal of pharmaceutical waste at various hospital facilities. The 6th meeting is, we had a meeting with the Senate Standing Committee on Health Services and deliberated on the issues of status of health facilities. And I hope the Speaker was present in that meeting. The 7th meeting, we had a meeting with this, we consider vetting of the Chief Officer for wellness and nutrition. Speaker, I'll not read all the 30 meetings. I'll go to the consideration of the bills. This Committee of Health have considered the following bills. The one, food fortification, legislative process, which we had the Nairobi City County Health Service Bill 2023. Committee adopted the report. We had Nairobi City County Mental Health Bill 2024 under consideration by a private member, Honorable Mark Mugambi, is under consideration. The committee had statements. We had 9 pending statements. The committee resolved that the CEC to come before the committee to respond to all unresolved statements next week on Wednesday. And that was a resolution which we made today when we had our sittings at the committee level, that all the pending bills, all the pending statements, the executive to appear before the committee. We have done site visits and the investigations. The site visit inspection within various hotels, restaurants, and clinics premises to undertake survey on compliance to health and sanitation regulation. We are planning to go for the site visits from next week and come up with a report as per Speaker's direction. We are also having inquiry on the operations and status of the county level 5 hospitals, which is ongoing. The last 2 weeks, we have been inviting the CEOs of the level 5 hospitals to give us the operations of the level 5 hospitals within the county. Workshops. This committee and have undertaken 4 workshops during the period under review to be considered. We had our 3rd quarter, we had our 2nd quarter, we had our 1st quarter, and the 4th quarter retreat, which will help from 18th to 21st April 2024 to be considered the draft report of Nairobi City County Food Fortification Bill 2023. Honorable Speaker, memorandum from the public. The committee received submission by stakeholders regarding the Food Safety and Fortification Bill. Budget oversight. Under budget oversight, Honorable Speaker, the committee didn't have issues. And during the supplementary, as a chair, the committee rejected the budget for the supplementary due to following reasons. There was introduction of new projects which were not in the ADP. There was removal of the ongoing projects, 33 ongoing projects which were removed from the budget, and it was in the ADP. And when I was sent by the committee to reject the budget in totality, I was surprised that what the committee recommended was not followed. Honorable Speaker, the health, wellness, nutrition was allocated 7.7 billion at recurrent and 1.13 billion for development expenditure. Honorable Speaker, we do have ongoing projects, some which are stalled due to non-payments of the projects. We have under 2024-2025, we have 15 ongoing projects. Some are at procurement stage, some are at inspection stage, some are at payment process. Honorable Speaker, monitoring and evaluation. The committee has emphasized on the need for strengthening monitoring and evaluation frameworks within the sector, and is actively following up with the county executive to ensure that all funded projects are tracked through quarterly report. Honorable Speaker, County Executive Committee member for the sector attends invited meetings to deliberate on various issues that affect or impact the sector. Honorable Speaker, the challenges that the committee is undergoing. 1, the committee has experienced delay in correspondence responses, and in some cases, the CEC and the chief officers not attend to scheduled committee meetings and keep postponing, thereby impeding timely decision-making and oversight. Number 2 challenge, rollover and stalled projects, making it hard for members to oversight during budget scrutiny and allocation of funds. Honorable Speaker, the committee achievements are as follows. The committee has provided input on proposed legislation related to health services, ensuring alignment with national laws and responses to the unique need of Nairobi County residents. Regular joint meeting held by committee to meet county executive and stakeholders have created an impact in the sector, especially in the legislation and budget making process. Honorable Speaker, recommendation on way forward for improving effectiveness in the health sector. The committee recommends that committee and county executive to strengthen monitoring and evaluation framework within the sector, ensure that all funded projects are tracked through quarter reports and projects implemented. Number 2, county executive to offer timely and comprehensive reports and responses. Number 3, county executive officer to honor committee invitation, failure to which sanctions be imposed. Number 4, committee to expedite on health-related policies and legislation proposals for effective legislative oversight. And number 5, collaboration with health, wellness, nutrition to enhance coordination and effective communication in order to address issues that affect and impact the sector. Honorable Speaker, just to conclude, this committee is dedicated, and with your support as the Speaker, we wish to thank you, the Office of the Speaker and the Clerk, the Nairobi City County Assembly, for the support extended to it while considering the committee businesses. Further, the committee extends its gratitude to the secretariat for their contribution during and after the deliberation and compilation of this report. Finally, I sincerely thank members of the committee for health, for their dedication and commitment during the exercise, which greatly contribute to the compilation of this report. Thank you, Honorable Speaker. Chair Maurice Ochieng.
Thank you, Honorable Chair. Honorable Majority Leader.
Honorable Speaker, I'm surprised.
Kindly press your mic on.
Speaker, I'm really surprised that the Chair for Health is being clapped because he has given a liturgy of a journey in the committee, but he has not spoken what he speaks in private about the challenges he's going through with the sector. That have really surprised me. The Chair for Health has accepted that all CECs and chief officers attend the meetings, but the private closet is crying, the chief officer, the CECs do not respect the committee. Honorable Chair, on that, allow me to ask this. Honorable Chair,
food program.
All these issues, he's been complaining and lamenting, the book of lamentation. Honorable Chair, allow me, Speaker, to ask the Chair 2 or 3 issues. Number 1, at what point did the sector decide to privatize pharmacists in our hospitals? Number 2, At what point? You know, when we grew up in Nairobi, all the vaccination for it's called what? Yellow fever was done in City Hall, either at Kenya Polytechnic or at the other side of Mabolak. So far, this thing, we don't know who gives it. It's now a private entity issuing it. It does not bring revenue to the county, but initially it was a source of revenue. At what point did the chair keep quiet on this? Because don't also allow us to help you cry. Yes. After your cry is sorted, you keep quiet. So, Chair, respond to us. When did you stop crying?
Thank you, Majority Leader.
On that note, Honorable Majority Leader, now that you have mentioned private entities being incorporated in our facilities, not limited to the pharmacy only, but even the radiology and CT scan being brought into our facilities for private use. So you also need to clarify on those areas.
Thank you, Speaker. The Majority Leader, due to time, I wanted to expound on some issues, but now that we are given 15 minutes, I was unable to go through even the same issues he has raised on status of Dishina County. We have pending statements. One, which was raised by Honorable Kennedy Swaka, MCA, on 29th September 2023, which is still pending, up to date. In the same breath, we have Honorable Joel Munuve, which raised almost the same statement on management of school feeding program, which is Dishina County. It was raised on March 2025. The statement is still pending, and today he appeared before the committee, and the members resolved to invite the county secretary, to invite the CEC, to invite the chief officer for wellness, school feeding, to appear before the committee on 16 April this year. We still have some other pending statements, the Majority Leader and the honorable members. Issue to do with public utilities being privatized. As a chair and as a committee, we came up and raised an issue which was discussed at the cabinet level, which never came to the Committee of Health.
Point of order, Honorable Speaker.
Whip.
Honorable Speaker. Honorable Speaker, as the chair proceeds, it's good that the leader of majority has said that he should strictly talk about the challenges. But Honorable Speaker, what has perplexed me, there is a member called Honorable Joel Munuve. I think, Honorable Speaker, nowadays I don't know if you have allowed this assembly to have bow ties. It's not properly dressed.
The bow tie is allowed, but I don't know whether Munuve is in a tie.
Is he in a tie, or what is it? Honorable Speaker, is it a bow tie or a tie?
Honorable Munuve, kindly Sergeant Atam confirm whether the member is properly dressed. Honorable Munuve remains standing. It is not. I've not given you an opportunity to talk. I've just instructed the Sergeant Atam to confirm whether you are properly before the assembly. Honorable Munuve, kindly please be assisted by the Sergeant at Arm. Get some time to adhere to the Speaker's dress code. Honorable Munuve, please, the Sergeant at Arm has confirmed you are not properly dressed. Honorable Chairperson, kindly proceed.
Thank you, Speaker. On the issue which has been raised by the Majority Leader on pharmacies being privatized, as a committee, we came out and we oppose. As a committee, we oppose the privatization of these hospitals. Reason, there was no legal framework and any policy that was presented to the Health Committee. And as I stand here as the chair, there is no hospital which the pharmacy have been privatized as I stand here. We also, as a committee, oppose the introduction of the CEOs at level 4 hospitals. And as I stand here, it has not been actualized because there is no framework, no policy to the level 4 hospitals.
Honorable Chair,
Speaker, I was
kindly for a way of clarification and to help these members understand. Honorable Chair, when we talk of our facilities, harboring some private services, like a case in Mbagathi Hostel, where we have a CT scan machine being provided, serviced, and run by an individual. I really don't understand whether you know the consequences that come with whether the service provider is licensed, and in case where now there is any form of damage caused by the machines, who will be held accountable? Is it the county? Who will be liable? And in case even of death in the same machine, when the procedure is being done, you are alive to the fact that we have a case in court which is ongoing on a mother who was going through a procedure and in the process lost her life. So this is something you need to look into critically as a chair of the sector. And those are the areas you would want help from the committee of the whole. Honorable Maurice.
Thank you, Speaker.
What is it, Honorable Member?
Honorable Speaker, just to give support to what you are asking, which is very critical to this engagement. I'm very surprised today that this is one of the perfectly working sector in this county, according to the chairman. I know for a fact, and I've shown the chairman and the committee letters showing that pest control services has been privatized to 14 service providers without going through the due process. I have shown him letters showing that the issuance of the public health certificates have been privatized to 8 providers without going through due process. All these things you're mentioning have been privatized. I am so surprised at what is happening in this assembly that now I see where the problem is. The problem is not the leadership of the assembly. The problem is
Thank you, Speaker. Please, may I just respond? Please.
Give Alai time to talk even 1 hour. Because Alai has just confirmed to this House, now he is able to understand where the problem lies.
Thank you, Speaker.
Honorable Chair, this is not what I expected of you. I really don't understand what has happened in between. But as the Speaker, I'm very keen.
Honorable Speaker,
Yes, Honorable Majority Leader, please.
just a point on what Alai has said. Alai, thank you. Please now you know.
Speaker.
I want the chair to assist you. No, and to also to assist other chairs. By you saying that as you've refused, that's not parliamentary. As we can confirm, there is no privatization. That's not parliamentary. Parliamentary requires, in fact, I'm so disappointed when a chair stands before this House, Honorable Speaker, as a leader of majority, that Honorable Swaka gave a statement in 2023, up to date, it has not been responded, that because the CEC or chief officer has failed to appear before the committee. And you know very well, as a chair whose statute, you know the procedure. You committed before this House that Honorable Swaka will be given a response in 2 weeks. Now it's 2 years plus another 2 months going on, but you are comfortable saying we could do nothing. Understanding what is very clear, if that chief officer has failed, do for us a report, bring to us. Honorable Chair, I want to support Alai for the first time. There is a problem. There's a big problem, Chair. There's a big problem. It is you who told me, Chair, let me confess this today. It is the same chair who told me, leader of majority, are you aware of privatization of services in clinics? It's the same chair. It's the same chair who told me, are you aware, leader of majority, that all the hospitals, people are private parking is being privatized? Honorable majority, are you aware that the CEOs are being appointed? It's the same chair today saying, my friend,
Thank you, Speaker. You give me time to respond on the issue of these equipments being privatized. The equipments under Procurement Act, they have a framework. When I raised an issue and we raised it in the committee, there's a framework that was followed. But on issue of medical certificates and pest control, we have invited the CEC to appear before the committee to give us the response why they are privatizing the medical certificates. When we did our site visits, we came up with a report in this assembly where we found most of food handlers, they have fake medical certificates.
Point of order, Chairman. Point of order, Speaker.
Yes, Whip.
Honorable Speaker, you see, that's why I want to support my leader of majority once for all, Honorable Speaker. And Honorable Speaker, you know, it was brought that you are holding brief for some individuals. But now, today, even Honorable Alai has seen that it's not the Speaker. Honorable Speaker, under Article 176 of the Constitution and Article 195 of the Constitution, it's very clear that if these members of the executive fail to do this, there are sanctions which have been provided in this Constitution, Honorable Speaker. So, Honorable Speaker, the chair should tell us how many people are sanctioned. Honorable Speaker, how many people who have been invited, who have been summoned, who have been even taken to dock. Honorable Speaker, you remember even Honorable the Governor for Isiolo was brought by the police to the Senate when he refused to come until even he paid fine, Honorable Speaker. Imagine a whole governor paying fine, Honorable Speaker. So, Honorable Speaker, as the chair proceeds, telling us how many sanctions has imposed, which challenges is he facing not to impose sanctions on those officers when after doing a thorough investigation, Honorable Speaker. Thank you.
Thank you.
Thank you, Speaker. You know, being a chair, you had 23 members, and we are in a learning process. We are in a learning process. And now, moving forward, as a committee, we'll now pull up our socks, because there's a time when the committee was very serious and there was a lot of intimidations from the executive. A lot of intimidations.
Honorable Chair, I think when you face the executive as a chair and as an individual, what you must expect intimidation. But when you face executive as a committee, when you conduct a site visit as a committee, yeah, and as an assembly, Chairman, I can confirm to you that no one in their own rights can intimidate you, the committee. The committee wield enormous powers as contained in the Constitution. So, Chair, please, just change your approach. I know you normally go to the talk shows and media outlets. As an individual, it's supposed to be a collective responsibility, Chair. Kindly take your seat, Chair. It's supposed, honorable members, kindly take your seat.
Thank you, Speaker. When you see me in those shows, I'm being sent by the committee.
Yeah. Kindly take your seat. Honorable members, it is only viable that when you want to make a press conference, you call upon the members of your committee to give you solidarity and concurrence on whatever you are going to relay to the electorate, so that the committee owns the report and the press, the message. But now, when you go out there and give a press conference, I want to give an example. A honorable member of this House was frustrated and went out there to a site, an ongoing construction site. This is Honorable Alai. Because the construction was ongoing in his ward, and as a member and a custodian, he had all the rights to go and ask questions. But now these people took advantage because he was exposed and he was alone. So the rogue laborers and site people took advantage of the vulnerability of him being alone. Yes. So he would have raised the issue with the committee, the relevant committee, and request this committee to conduct a site visit in his ward, where we facilitate them with armed askaris, our sergeant at arms in uniform, and the clerks. Honorable members, you have all the tools of trade with you at your disposal. At no given time, any committee has approached the Speaker to approve any site visit, and the Speaker declined. Honorable Maurice, you have committed before the assembly that you are in the learning process, which actually should not be the case 2.5 years down the line. But now, this being a unique situation, and for the very first time, you to appear before the plenary to give the status report, I hope the House will give you some sort of leaf of life for today. But going forward, we need you to adjust and give accurate information. Members, why I'm abstaining? Based on the two presentations by the two members, the two chairs, you make me feel like I'm out of position, because what I'm seeing here is now next thing, we are going to handle issues of tribalism. Next thing here, we are going to handle issue to do with friendship. We have just adopted a report of the Procedure and Rules Committee here, which will compel the CECs, the CEOs of various corporate bodies, and the chair to appear before the plenary to be asked hard questions. But you are just confirming the fear that that is not going to be the case. If you're going to coil yourself that you don't want to put these people to task, then now I'm sorry, and time is really running out. Time is really running out. Had indicated here that we must get the train on the track. And I'm determined that the train must be brought back on the track. And that is the agenda. And that is the agenda. If you are not ready to walk this journey, the committees must be active. The leadership must come out and get back the train on the track. There is nothing less than that, honorable members. And I hope I'm clear. So, the other chairman, please. You need to conclude? Yeah, I wanted to. Thank you. Honorable Ochieng Gives, you can't inform the chair? I'm sorry.
Mr. Speaker, I had appreciated the members of the committee, your office, that of the clerk. Allow me just to read part of the report. But I also want members to understand that the scope of the work of the sector, we are actually oversighting 6 sectors. So the report may look so big, members could get tired because of the long speech, but it's important for them to understand the sector that we oversight. So allow me to just say